open the public hearing for House Bill 1045 and invite O'Mara Harrington, our fabulous OPR staff, to share information about the bill.
For the record, O'Mara Harrington, staff to this committee. House Bill 1045 establishes the Evergreen Basic Income Pilot Program. Just to provide some really brief background on basic income programs. Basic income programs are programs that provide unrestricted and unconditional cash benefits to program participants, and maybe in the form of universal basic income, which would provide a benefit to all persons, or guaranteed basic income, which would provide a benefit to a certain targeted population that meets income or other eligibility criteria. There are some locally based guaranteed basic income pilots that have occurred or are planned by local governments or community organizations throughout the state, but to date, there has been no statewide initiative. Turning now to House Bill 1045, under the provisions of the bill, the Evergreen Basic Income Pilot Program is established within DSHS. Beginning July 1st, 2024, DSHS must provide 24 monthly payments to up to 7,500 qualifying participants in an amount equal to 100% of the fair market rent for a 2-bedroom dwelling unit in the county in which the participant resides. So currently, this would range from $892 to $2,199. The program is administered by a board of directors made up of DSHS staff, tribal representatives, and community organizations. And to be eligible to participate, a person must be at least 18 or an emancipated minor, a resident of the state, have reported gross income that does not exceed 200% of the federal poverty level, and must also be a person who is currently pregnant or has a child under 5, is experiencing homelessness, is an immigrant, refugee, or asylee, is exiting from the foster care or justice systems, is exiting a relationship or living situation due to domestic violence, or is a person with a disability or behavioral health disorder. Participants must be distributed among 9 identified regions and in proportion to the share of people living in poverty in each region. And DSHS may collect data from participants on a voluntary basis and offer incentives to encourage participation in data collection efforts. The agency must submit a report to the legislature and the governor evaluating the program and making recommendations for an ongoing basic income program. Lastly, the bill contains a number of provisions to mitigate the impact of participation on eligibility for other benefits programs, and participants are offered benefits counseling. They're entitled to reimbursement for the loss of other benefits due to participation, and are provided re-enrollment plans for lost benefits. And with that, I'll conclude my briefing.
Thank you, O'Mara. Any questions for staff? All right, seeing none, I'd like to call up good Representative Liz Berry, the sponsor of this bill.
Do I just talk? Oh, hi. Thank you, Chair Sen, for having this bill be your first bill of the committee. I'm so excited. For the record, I'm Representative Liz Berry from the 36th District. And we have been working on this concept for over 18 months with hundreds and hundreds of stakeholders and with the department. And you'll be hearing from the department after I speak about the pilot study they conducted that this legislature funded for them to do. Everyone in Washington should be able to meet their basic needs and care for their loved ones. And that means paying for essentials, housing, food, being able to see a doctor when you're sick, reimagining a different future for themselves and their families. We know that giving people cash with no strings attached works. We did it during the pandemic when millions of families in America received stimulus payments and poverty dropped to its lowest rate in decades. That's why I'm so excited to present this bill to you that would establish the Guaranteed Basic Income Pilot Program in Washington State, the first of its kind. There have been over 100 GBI pilots in more than 100 cities across the country. We've had them here in Tacoma and King County and Seattle. We're going to have someone here from Tacoma telling you about the success of that program here today. With basic incomes, more people are able to afford food and housing, pay off debt, get full-time jobs, save for emergencies, and get the physical and mental health support they need. Thank you for this opportunity to bring this bill forward today. I'm happy to answer any questions, and I'm really looking forward to the conversation.
Thank you, Representative Berry, for bringing it forward. Any questions for the prime sponsor? All right, wonderful.
Thank you.
Thank you. And at this point, I'd like to call forward Lori Finks from the Department of Social and Health Services, who I believe is remote.
Good afternoon, Chair Sun. Can you hear me?
Yes, thank you, Lori.
Great. Well, good morning, Chair Sun and members of the committee. For the record, I am Dr. Lori Finks and serve as a Senior Director in the Department of Social and Health Services. And in this role, I was a member of the project team that developed the basic income study submitted to the legislature in June of 2022. DSHS is signing in neutral on House Bill 1045. Our goal for today is to briefly provide background on the basic income feasibility study as it relates to the bill and to clarify ambiguities related to IT impacts, time to implement, and potential effects on eligibility and benefit levels. Our intention is to ensure that a GBI pilot would have sufficient funding and agency support to successfully operate. The legislature directed DSHS to conduct a basic income feasibility study and budget proviso in 2021. In your materials for today, we have included the presentation from the December 2nd work session on basic income, in which DSHS presented the summary of findings and recommendations in the study. To briefly summarize, in the study team's review of the state of health and human service programs, the research literature on basic income, evaluation of local pilots occurring across the country, and conversations with people experiencing economic hardship and many people in the field, we concluded that a guaranteed basic income would have a net positive contribution to the well-being of Washingtonians. House Bill 1045 is aligned with the study recommendations for a state-level pilot and includes two recommendations that the study team saw as foundational to the study design: making the amount of basic income equal to a percentage of fair market rent, and having an administrative structure for state agencies to work in collaboration with tribal and community partners to administer the pilot. Fair market rent was chosen because it is widely recognized that the lack of affordable housing is driving the homelessness crisis, and people throughout the state are finding it increasingly hard to pay rent. In addition, family market rent adjusts for cost of living across the state, as well as annual changes in the market and inflation, making it a useful benchmark. The recommendations for state agencies, tribal nations, and community organizations to partner was made to ensure that the pilot reaches people in communities historically excluded from well-being, including those from Indigenous, Black, Brown, rural, LGBTQ, disability, and immigrant and refugee communities. To ensure that the pilot would have sufficient funding and agency support to successfully operate, DSHS needs clarification on the following in the bill. The IT impacts are unclear. On page 5, line 2, the bill states that the department shall contract with a third-party vendor to process and approve applications. Without knowing the specific vendor selected, agencies cannot know which IT functions related to eligibility, enrollment, and cash issuance will ultimately be covered. So should DSHS or other agencies be expected to operationalize any aspect of the pilot not covered by a third-party vendor, we would just need sufficient funding to do so. If DSHS does need to operationalize any part of the pilot, we may need additional time to implement. So the effective date of July 1st, 2024 may not be feasible. And there may be potential impacts on a few public assistance programs that are not identified in the bill. Agencies right now are working together to make sure that impacts to public assistance programs are clearly understood so we can protect benefits for pilot participants as much as possible as the bill intends. So we are happy to provide a mandatory language as we think these issues can all be addressed to ensure a successful pilot, and very much appreciate the opportunity to share our feedback on the bill and our role in the study, and I'm happy to answer any questions.
Thank you. One question, Representative Ortiz-Self.
Thank you, Madam Chair. Just for clarification, if the recommendations were implemented that you listed, that would take you from neutral to yes?
I cannot answer that question.
Okay, thank you.
Okay. Thank you, Lori. I would now like to call on Vice Chair Cortez to call up the first panel.
Thank you, Madam Chair. We do have a panel including Victoria Woodards, Tracy Young, and Jennifer Bearskin. All three are remote, and up on deck will be three in-person panelists, including Sean Scott, Abigail Lawson, and Debbie Wilkerson.
Whichever of you would like to go first.
Jennifer, you can go.
Okay. We at Jennifer Sista, Stahopstad, Renanagachtad, Bedat, Swaklam Tagwitsi. Hello, my name is Jennifer Bearskin. I am Snohomish and Ananagan, and I am the youngest daughter of the Sea Monster Man. Good morning, Madam Chair and the members of the committee. I live here in Bothell, and I am testifying in strong support of Housing Bill 1045 to help create a guaranteed basic income program in Washington State. And as a person who has lived 38 years of her life in poverty, I know you're going to hear a lot of data and important information, but as a human being here before you, I just would like you to acknowledge the importance of this. Each person deserves to have the ability to take care of themselves, to feed their family, to obtain shelter, to maintain shelter, and to be able to be respected as a human being. You know, poverty is preventable. Poverty is preventable. It is not a personal choice. No one wakes up in the morning and says, I want to live in poverty. And despite my abilities as an Indigenous woman and a mother who's been through higher education, who's worked several jobs, I had still not been able to lift myself out of poverty because this is a systemic issue, which means it's going to take a systemic change for people like myself and my son and future generations to be able to be uplifted out of poverty. I just want to say all of the people that are working on this are incredible advocates and have such the best of intentions. And, you know, it's hard to have been a child growing up here in Washington and to know that when you're in poverty, people don't look at you as a human being. And in our culture, in our Indigenous teachings, we're told that we have to yahout. And to yahout means we have to push forward together, that it can only be completed together. So meaning that any task that we have in our life, it's going to take more than just yourself. It's going to take a community to do this. And so
Thank you so much, Jennifer.
Thank you.
Really appreciate it. And I apologize to Jennifer. I did not mention that we are going to have a timer for 2 minutes. We have a lot of people signed up and want to make sure that we can hear from as many people as signed up. So thank you, Jennifer, for being the first to go. And that was very meaningful remarks. So we will have the timer going. You can see the lights in the front of the room. Green means continue talking. Yellow, you're getting close to out of time. And red, I'm going to ask you to stop talking. Thank you so much. Oh, and please proceed.
Good afternoon, Chair Sen and members of the committee. My name is Tracy Young, and I'm a policy analyst at the Washington State Budget and Policy Center. The Budget and Policy Center strongly supports House Bill 1045 to create a guaranteed basic income program in Washington. We believe everyone deserves the essentials: safe, stable housing, sufficient nutritious food, and medical care when needed. However, thousands of families across Washington are unable to have these essentials, while corporations keep driving up the cost of housing, medical care, clothing, and school supplies, while reporting record profits. These same wealthy few throughout history have kept wages low in professions dominated by women and Black, Indigenous, and people of color, who are also more likely to be saddled with unpaid labor, such as caregiving. In addition, discriminatory employment practices systematically exclude many people from the workforce, such as people with disabilities, people who are formerly incarcerated, and people experiencing homelessness. A basic income would have an outsized positive benefit for these populations and begin to rectify the income inequities in our state. We know that giving people cash with no strings attached works. Last year, child poverty dropped to its lowest rates in 35 years, thanks to the expanded child tax credit, keeping 2.1 million additional children out of poverty. Basic income programs across the country have shown improvements in poverty rates, mental health, food security, child development, employment, and housing stability. GBI differs from the current public benefit system by providing greater freedom and dignity to its participants through unconditional, unrestricted cash payments. Personally, that freedom and dignity would have made a huge difference for my family. Growing up, I almost exclusively ate Kix and Cheerios for breakfast because these were the cereals approved for by WIC. Honey Nut Cheerios was a luxury in our house. We would also drive further from home to buy groceries so that we wouldn't run into anyone we knew and face the stigma of using an EBT card. Washingtonians know how to take care of themselves. The Washington State Budget and Policy Center urges this committee to pass House Bill 1045 and give families the autonomy to decide how to best meet their needs. Thank you for this opportunity to testify.
Thank you so much. And now I'd like to welcome Mayor Woodards.
Good afternoon, Chair Sen, and to the committee members. It is an honor to be here with you today, and I thank you for the opportunity to testify in full support of House Bill 1045 today. As it's been stated, I'm Victoria Woodards, and I have the pleasure of serving as mayor of the city of Tacoma. And I also want to thank Representative Berry for her leadership on this important issue. I'm here today not to tell you about how important MGI, how important guaranteed income is, and not just from the perspective of knowing that it works, but actually having it done here in Tacoma. Tacoma's Guaranteed Income Pilot Program was just completed in December, and it was the first of its kind in the state, called Growing Resilience in Tacoma, or GRIT, as we're known as the Gritty City. MGI, which started with about 10 mayors in July of 2020, has now, which is a national organization, has now grown to over 100 mayors who are a part of this organization. At a future work conference in September, one of the presenters shared data that says, and in the very beginning, very few people supported basic income, but they shared data that said 55% of Americans support a basic income program. And I find that very encouraging, but I'm even more excited about it because of what happened in Tacoma. GRIT in Tacoma was a partnership with the United Way of Pierce County, who administered the program. We provided over 110 families chosen by a lottery system with a $500 a month stipend for 12 months. Our participants were ALICE, asset limited, income constraint, and employed. What we know about ALICE, these are people who wake up every day attempting to provide for themselves and their families and still aren't able to meet basic needs. We know that in Tacoma, 40% of the people who live here are ALICE families. And during this 12-month program, what we learned is that when you allow people to spend money where they see fit, they do buy necessities like food and clothing and gas and mechanical repairs and bills and improving credit scores. You're going to hear from Debbie shortly, who will share with you her personal story. But I just encourage you, this does make a difference, and it really does change the lives and the trajectory of families in our community. And I hope that you all will look to pass this bill and give every family in Washington State the opportunity to succeed. Thank you.
Thank you, Mayor Woodards. Thank you for leading Tacoma and Washington State in this basic income pilot.
Thank you.
Vice Chair Cortez.
Thank you, Madam Chair. Next, we'd like to call up Abigail Lawson, Debbie Wilkerson, and one remote testifier, Sean Scott.
Debbie's also virtual today.
Okay. So Debbie Wilkerson is also virtual. And on deck, we will have Mary Long, who signed in as in person.
Go ahead. Great. Good afternoon, Chair Sen, members of the committee. My name is Abigail Lawson. I serve as the director of Tacoma's Guaranteed Income Program, GRIT. Today, I'll be representing not only my own voice, but that of United Way of Pierce County and our CEO and president, Donna Panapinto. I'll share my perspective of someone that works full-time in the Pierce County human services industry, as well as someone that spent quite a bit of time traveling throughout the guaranteed income world these last couple of years. That perspective has come to show me that people within Pierce County, and certainly we're not alone in that, are relying on human services at an unprecedented rate. They're really record-breaking levels is what we're seeing. Like I said, we're not alone in that. And many individuals that fit within that demographic are employed, sometimes working 1, 2, 3 jobs. All of our recipients in Tacoma were employed, and through no wrongdoing of their own are unable to afford basic necessities. This, I think, is due to many different reasons. I'll highlight 2 of them for you today. One is that many of our current social safety net and current social services are connected to the federal poverty level. The federal poverty level, for context, for all those listening right now, for an individual comes in at $13,000 a year. $13,000 isn't even enough for rent in Tacoma. It's not enough for rent throughout much of the state. And connecting social services to that level means that a lot of individuals are making sometimes $22 or $13, just a little bit too much than what would qualify them to receive support. The second system failure that I want to highlight for you today is that our human well-being currently within America is connected to our market and is connected to our economy. The American market and American economy is inherently volatile, meaning that we are creating a volatile system for human well-being to thrive and to flourish. And what a guaranteed income does is it disconnects the two, is it detaches human well-being from the American volatile market. That has an inherent benefit in many different ways. Like you heard from Tracy, we're seeing a lot of impacts around the country. We're seeing a stimulant in education and employment attainment. We're seeing individuals play soccer and football for their first time in Tacoma. We're seeing stimulants in gender and racial income equity. And those are just some of them. I would encourage you to look through the feasibility study to identify other impacts. With that, I'll close and just encourage you to really look through the feasibility study. They've done a phenomenal job. It goes really in depth, and thank you so much for your time.
Thank you so much. And now Debbie.
Can you welcome committee? Can you hear me?
We can, Debbie. Thank you. Please proceed.
Good afternoon, committee members. My name is Debbie Wilkerson, and I was the recipient of the Guaranteed Income Program in Tacoma. I live in Tacoma with my son, Sean, and my grandson, James, who is 13 and on the autism spectrum. I had to retire early during the pandemic because of the homeschooling. I testified today strongly for the bill 1045. I received the income without no doubt. And with that income every month, me and my son, my son is a full-time worker. I retired early, work part-time, but I home care and take care of my grandson. With the money that we got from the GRIT program, it allowed us actually to clean up our credit and to be able to get a mortgage someday to buy our own place. So James has a place of his own to live. Kids with disabilities are stuck in institutions or places where they can't flourish. Our goal is to hopefully someday James will flourish. With that money that we got every month, we actually cleaned up our credit, but now the interest rates were kind of high, so we were kind of looking for a house. But that was able for us to do that. We didn't qualify for any benefits or anything because we were $22 over our income limit as a house of three. What I have noticed is over the years that our incomes have gone up, things have gone up, but the eligibility income limits have not gone up. So with this, I want to thank you for this program, to the mayor, to Abigail, and for the housing to please pass this program. If people in poverty and low income, we're not lazy, we're very hard workers.
Thank you so much, Debbie. I know we have a question from, if you're willing to entertain a question from Representative Rude.
I am.
Oh, okay.
I'm trying to not be emotional.
That's fine. Actually, Debbie, why don't we hear from Sean, and that's your son?
Yes, he is. Sean.
Oh, it's not a different Sean?
It's a different Sean.
Oh, different Sean. Okay, I apologize. One of the speakers is the next speaker is Sean Scott. So I thought he was your son. I apologize, but no, I love it. Small world. I don't want to put pressure on him, but thank you. Thank you so much. Very meaningful story.
No worries.
Representative Root, I believe you had a question for Abigail, actually.
Yeah,
thank you, Debbie.
It could probably go to anybody who's testifying on this bill, but I'm a little bit confused because I'm looking at the federal poverty level, and then calculating minimum wage at full time. It doesn't seem that a person who is working full time, which would be at least minimum wage, would even qualify for this. So I'm thinking of that minimum wage worker who might even have a child, and still looking at these numbers, I don't think would qualify for this program based on their income. So kind of one, and of course, we know that high cost of housing is hurting many people, especially in urban areas. So am I understanding correctly that this wouldn't necessarily capture a person who's actually working full-time with just as an individual or with one child?
If Sean is available, Sean's actually our expert on the bill, so I would push that question to him.
That is fair. Great. Thanks, Abigail. Again, thank you, Debbie.
Thank you.
And we will welcome Sean Scott to
Excellent.
the committee.
I love my mom, but we should all be so lucky, I think, to have a parent like Debbie that's willing to come in front of the committee, talk about very vulnerable experiences. I want to get to the gentleman's question that was just asked with respect to the poverty limit. After getting through some of the testimony I'd planned to give here. My name is Sean Scott, he, him pronouns with the Statewide Poverty Action Network, and we were really proud to help craft House Bill 1045 and working in coalition with Representative Berry's office and others in the creation of the Evergreen Basic Income Pilot Program. You know, all shades of the political spectrum pretty much know that cash assistance works. Historically, this is an idea that has been supported by Richard Nixon and by Dr. King. Active GBI programs presently exist in the state of Alaska and also in the cities of Shreveport, Louisiana, and Tacoma, Washington. In 2021, a bill creating the Working Families Tax Credit passed in this chamber by a vote of 93 yeas to 3 nays. And lawmakers who passed that tax credit 2 years ago and who also created the Washington Workforce Program in 1997 understand that direct cash payments can help struggling working people. It can help elders on fixed incomes, and it can help the disabled make ends meet. We listened to the gentleman's presentation earlier about the Aged, Blind, and Disabled program with small cash grants in Washington State, and we know that those residents, as well as Washington State residents over age 65, are not the only ones who would benefit from assistance. A lot of people talk about the cost of implementing a guaranteed basic income, but at Poverty Action, we like to think about the cost of not doing it. This is about sharpening a tool that we know is going to help people pay down medical debt. It helps people access higher education and job retraining programs, and it's also going to help people pay down utility bills and put food on the table. So we look forward to a robust discussion about how we can expand the reach of cash assistance in Washington State with Evergreen Basic Pilot. To answer the question that was asked earlier about, you know, how much funds from the proposed program would, you know, get people towards the federal poverty limit. I don't know if you know, the person who may have asked that has ever had the experience of living through poverty for any stretch of period of time, but I can tell you for sure that one of the things that people think about in that condition is not the federal poverty limit as a graph, but every little bit helps on a day-to-day basis. It's about day-to-day people having what they need to get by. We can have a more abstract conversation about what it needs to have more robust cash assistance programs to get people above the federal poverty limit, and what it would look like to have a world where poverty doesn't exist. But while we're talking about this now, it's about helping people in the immediate with action that can actually be taken in the state legislature. So that's why we're really proud to be backing you know, Washingtonians like Debbie and others who would really stand to gain immediately from the implementation of a GBI in Washington State.
Thank you, Sean. To follow up from Representative Rood.
I just want to make sure I'm clear with my question. I'm just thinking of a hypothetical. If there was a single person, for example, who was released from prison, which I think that was one of the qualifiers, I don't believe that they would meet the income threshold, and this bill would not assist that person recently out of prison as a single person, because if they had a full-time job at minimum wage. Is that your understanding as well?
And maybe we can get some scenarios and dig into them.
And maybe
that
I
would
can
be
connect with
helpful.
the sponsor too. And
Sure.
Thank you.
Thank you. Appreciate it. Mr. Vice Chair.
Thank you, Madam Chair. If we could have Mary Long, who signed in as in person for testimony. And if she is not present, we could move to Rebecca Faust, Leah Anaya, and Cindy Tucker. And on deck, we'll have Andrew Gillen, Robin Hills, and Katrina Johnson.
Hello?
Oh, hi, Mary. It looks like you're on remote. Wonderful. Thanks for joining us.
Oh, good.
Please
I was
proceed.
afraid that I signed up wrong.
Yeah, no worries. Please proceed.
Thanks. Good afternoon. I want to thank you for the opportunity to testify before you today. My name is Mary Long, and I'm testifying on behalf of Conservative Ladies of Washington, and also as a concerned citizen in opposition of House Bill 1045. This bill is a step toward a universal basic income program, an expansion of the state's welfare system, and just citing that 2021 study by the Washington Employment Security Department, the bill explains that corporate profits have risen by 500% since 2000, but it generalizes an increase in unemployment claims since the onset of the COVID-19 pandemic, describing the increase as more than ever. There's no mention of the impact of the government shutting down businesses that no doubt contributed to this more than ever increase in claims. It would seem the government's trying to fix a problem that it created. This program seeks no requirements for the recipients, stating that the legislature finds that a direct cash assistance program with no restrictions or requirements would help Washington residents struggling under the weight of unprecedented income inequities. The applicant needs only to self-attest that they fall into the category of targeted recipients. In fact, they need not even be Washington residents. They could arrive in Washington and apply on the same day that they arrive. As the bill states, a person does not need to live in the state for a specific period of time prior to meeting the requirements in this subsection before being considered a resident. There's no mention in the bill also how it will be funded. It's likely that it would just simply be an increase to the astounding $17 billion biennial DSHS budget. The bill's too broad, too lax, too big, and it leads to even more residents in our states becoming dependent on the system. We need to pass programs that encourage people to get out and work and better their circumstances, that incentivizes that. The state must stop disincentivizing. Please vote no on advancing House Bill 1045. Thank you so much.
Thank you, Mary, for joining us.
Thank you, Mary. If we could have Rebecca Faust, Leah Anaya, and Cindy Tucker. And on deck, we'll have Andrew Gillen, Robin Hills, and Katrina Johnson, please.
Thank you for Rebecca for joining us. Please proceed. It looks like you're on mute potentially. We can't hear you.
Thank you. Now can you hear me?
Yes, we can. Thank you.
My name is Rebecca Faust. I'm here in opposition to this bill. I'm not with any organization. I'm just here myself as a citizen. I live in Tumwater, Washington, but I'm just here not with any organization. So I'm here in opposition to this bill. You know, it's kind of ironic because I probably could benefit from the bill in a personal capacity because I make under 200% of the poverty level and I'm on SSI, I'm disabled. But I also understand that there's no such thing as a free lunch, so to speak. And I oppose basic income because I think it's not good for society in general, and it's not what's going to be fair and beneficial in the long run for everyone. I also think that while some safety net may be necessary, having a safety net that doesn't require those who are able to work and to try and become self-sufficient if they're able to do so, and lumping immigrants in with refugees and then throwing in people who whose qualification is that they are getting out of the justice system. You know, I think the bill is kind of a mess. And I kind of oppose basic income in general. And yeah, that's where I'm at with it. So I oppose the bill. I think also if you were trying to help people on SSI, and if you do go forward with this, also it's going to be a problem that we can only have $2,000 in the bank, but I think you probably shouldn't go forward with it anyway. So, yeah.
Thank you. Thank you very much.
Yeah.
Appreciate you coming forward today.
Thank you.
Our next presenter is next. Leah.
Can you hear me?
We can.
I'm not sure why my camera is not working, but
and one moment here as well. There we go. Perfect. Hi, Leah.
and I unmuted myself too. Look at that. Okay, my name is Leah Anaya, and I am here on behalf of Washington Moms for America to testify against this bill. We can't allow the recent pandemic to reduce our quality of life in this to this new normal. This bill to me says that we're waiting around for the next mass disabling event and almost gives the feel that we will create a situation like this to test out a state-funded income. I believe a state-funded income is a dangerous precedent to set. Yes, as a society, we must take on basic human needs of those such as disabled, elderly, single parents, etc. But giving an income as outlined in this bill to everyone who qualifies anytime they qualify will incentivize a huge group of people from having a job and being a productive member of society. Wouldn't go to WIC for us, but I worked hard and I pulled myself out of that. And I wanted to make sure that my children didn't live like this as well. This bill is here to not advance this bill. Thank you.
Thank you very much. And now Cindy Tucker.
Hi, I'm Cindy Tucker, and I want to go on record as being against this bill. I do really appreciate helping hands, but not handouts. My husband and I have gone through many years in our marriage where we had issues with income because of layoffs and him having to go through retraining for work. But what we have found is that when we started getting handouts, we started to become dependent, and it got very scary for us because of the fact that as we started to rely on them, we stopped realizing that we actually could make a difference ourselves. We were expecting others to do it for us. And I see this bill as another way to say, whenever something is considered an emergency, the government can just decide when it's going to start making controls over our lives. And we have, as a human, it's just human nature that if you start getting handouts, you're going to start expecting them, and it's going to continue. And that doesn't mean, again, that we can't have that safety net as just been described before, but no strings attached starts to imply that it's unlimited supply, and the taxpayers that we already have extremely high taxes, this is just going to fall on our shoulders again. Additionally, during this pandemic time when people were getting this money, many businesses did not have the people coming in, the employees coming in, because they couldn't find employees. They were getting money from the government as opposed to going out and working for it. And so many had to shut their door during the time that they would actually be open. They were help wanted signs everywhere because of this. And so this is not helping people on a long-term basis. It's literally making us slaves to the government and their decisions as to how we're supposed to run our lives. So I ask you, as a person who you work for, to vote no against this bill. Thank you.
Thank you, Cindy. Mr. Vice Chair.
Thank you, Madam Chair. If we could bring up Andrew Guillen, Robin Hills, and Katrina Johnson, all three are remote. And on deck, we'll have Thomas Marabello and Janet Large.
Welcome, Andrew. Please proceed.
Good afternoon. My name is Andrew Guillen. I am the Chief Public Affairs for Seattle Indian Health Board, a federally qualified health center that provides service to all. We are entering our 53rd year of operation in Seattle, Washington, and I'm here today to provide Seattle Indian Health Board's full support for the creation of the Evergreen Basic Income Program. For the past 17 years, I have served at Seattle Indian Health Board in a variety of roles, working directly with the community to try and improve health outcomes for urban dwelling Indigenous people. We know that American Indians and Alaska Natives in the state of Washington have higher levels of poverty, higher levels of infant mortality, shorter lifespans. And throughout my time in the clinic, I have heard many stories from our relatives. That's how we refer to the community members that we serve, because we believe that we are all related. I've heard many stories about their inabilities to pay for basic necessities such as transportation, food, housing, things that many of us take for granted. The Evergreen Basic Income Program has the potential to provide economic empowerment for Washington State's most vulnerable populations, including American Indian and Alaska Native people. These funds can provide economic stability for 7,500 individuals. House Bill 1045 addresses financial barriers for laying the foundation, equitable economic program to provide assistance and access for individuals to have a greater freedom, dignity, and economic well-being in caring for themselves and their families. Seattle Indian Health Board supports House Bill 1045 to provide a fundamental solution to addressing economic inequality to those who live 200% below the poverty line. Thank you.
Thank you, Andrew. And now I'd like to welcome Robin.
Good afternoon, Chair Sen and members of the committee. My name is Robin Hills, and I live in Lake Forest Park, Washington. I'm a medical student at Washington State University, and I'm here today speaking on behalf of Washington Physicians for Social Responsibility as a member of their Economic Inequality Task Force. We are a health professional-led advocacy group. I'm testifying today in strong support of HB 1045 to create a guaranteed basic income program in Washington. We believe everyone in Washington deserves access to healthcare without having to worry about the inherent financial burdens. As physicians and healthcare providers, we understand firsthand how income inequality, poverty, and cost of living have a profound impact on health outcomes. We have seen evidence from scientific studies that GBI programs work. Targeted guaranteed basic income programs are highly effective in increasing financial stability, interrupting racial wealth inequities, and improving health for enrolled participants and their dependents. There is very strong support in the medical community for this GBI pilot because research has shown that GBI improves health and well-being. In fact, just this past September, Washington State Medical Association passed a resolution in support of this legislation. At more than 12,000 members strong, the WSMA is the largest physician professional association in Washington, representing all specialties and practice settings. Putting money in the pockets of the lowest income Washington residents will have a dramatic effect on their health and allow for expanded access to health care. With basic incomes, more people are able to afford the physical and mental health support they need. Cash payments dramatically improve the lives and health of our patients. I urge you to pass House Bill 1045. Thank you.
Thank you, Robin, or Dr. Hills. And now I'd like to welcome Katrina.
Good afternoon. I am Katrina Johnson with Food Lifeline. I am testifying today in strong support of House Bill 1045 to create a guaranteed basic income program in Washington. Cash puts dignity, creativity, and choice back into the hands of those receiving it. Access to cash is the simplest, most effective way to lift families out of poverty. With poverty tied to poor outcomes in health, nutrition, education, housing, employment, and more, cash transfers offer households the opportunity to respond to their most pressing needs that they identify for themselves. Cash payments dramatically improve the lives of our neighbors and communities. I urge you to pass House Bill 1045. Thank you.
Thank you very much. Mr. Vice Chair.
Thank you, Madam Chair. We have Thomas Marbello and Janet Large, both remote. And on deck, we'll have Paula Sardinas, Janice Henry.
And Thomas, if you're with us, please go ahead.
Thomas isn't here, Madam Chair.
Okay, we don't have Thomas with us, so let's go forward with Janet. Thank you, Joe.
Hello.
Hi, Janet.
Thank you guys for having this so that we can speak. I am a citizen and I am very concerned. I am voting no. This is not okay. What is happening is we are enabling instead of teaching our communities that are at risk how to get out of poverty, financial education. What you're doing is dragging other people down into poverty. And I am not going to tolerate it anymore. I worked hard to pay off my house. My taxes, property taxes, cost more than my original house payment. No, you need to figure out how to help people without driving the rest of us. We are not a socialist or communistic country. We are capitalists. We need to figure out how to help people help themselves. There are courses and there are all sorts of things that you can dump your money into to teach people how to be financially secure, how to get that money, how to save it. So right now, all I can say is I am so upset with you guys making me more poverty, and I came from poverty. And we stood up and we pulled our bootstraps up and we made it. And everybody has that opportunity. Don't take my liberty away. Thank you.
Thank you, Janet. Next up, I don't see Paul. I don't see Paula in the room. Is Janice Henry here? Do we see either Paula Sardinas or Janice Henry remote?
Janice Henry should be remote.
Okay. Janice, are you ready?
Yes, I am. Thank you. Good morning, Senator, and committee members. My name is Janice Henry. I'm sorry I had this whole thing written out, but I'm so enraged. I am in full support of HB 1045 to create a guaranteed basic income program in Washington. Let me tell you about myself. I'm an educated Black woman. I had a very lucrative job in aerospace when the pandemic hit. I worked through the pandemic. I took care of my mother, and I'm still taking care of my mother today. Taking care of my mother is a 24-hour job. My mother has Alzheimer's and dementia. I chose to do that and I should not have to worry about if my light bills are going to get paid or if I'm going to get evicted because I chose to take care of my mother. I'm not sitting around asking for a handout. Okay, I stepped down from a career in aerospace to take care of my mother. When COVID hit, it took all of my savings, okay? Months of stretching it out turned into years of debt. I'm so far into debt, I'm about to get evicted out of my house. So, okay, I want to remain with what I have, but it's not feasible because guess what? Every year, my rent goes up 10%. Everything goes up. My wages don't go up. This year for Christmas, I had to figure out how not to get evicted, how not to have a Christmas and still just make it through. Just necessities, okay? Lord, I'm sorry I'm getting so emotional. If I get a second job, I get paid to take care of my mother. Taking care of my mother is a 24-hour job. If I get a second job, I won't have adequate coverage to take care of my mom or anybody to support my mom. With basic income, it would allow me not to stress between rent and paying my light bill. It would allow me to take better care of my mom and better improve my community. More people will be able to afford food, housing, pay off debt, get full-time jobs, save for emergency, and most importantly, get the mental health support and physical support that we dramatically need to improve our lives and our neighbor lives and our communities. I urge you to pass HB 1045. I'm sorry for getting so emotional, but this is right now, this is real, this is my life. Like, I'm not begging or like panhandling. I work every day, and it's just offensive, you know, because I need help, and this bill would help me to help myself.
Thank you so much. Thank you, Janice, and you have a lucky mother.
Thank you.
Thank you. Mr. Vice Chair.
Thank you, Madam Chair. If we could have Amy Rourke, who I believe is remote.
Hello. Thank you, Chair Sin and members of the committee for your time today. My name is Amy Rourke, and I am a member of Children Alliance, as well as a member of the Poverty Reduction Work Group. I'm here to testify today in strong support of House Bill 1045 to create a guaranteed basic income program in Washington State. I'm a constituent in the 49th Legislative District and a single mother of 4 children, and molding the future of these young adults. It has been difficult for me to find work and provide for my family because I pour a lot of time into advocating and supporting my 2 children who have special education plans while also addressing my own mental health issues. I have found small opportunities to receive gift cards and stipends using my lived experience. I have been resourceful and independent, and it still hasn't been enough. I know my life could have been different than the one I live today, but due to a tragic accident, my mother passed away when I was 14, and I didn't have the support. I didn't have no one to support me for my goals. There are many people like me who don't start life with resources and relationships that they need to live a healthy life and provide for our families. People who experience tough life transitions like my own just need a little help to find our way out of poverty. The answer to addressing poverty is simple: give people money. During the pandemic, I started receiving federal stimulus checks and unemployment checks. It was money I didn't have to pay back and had no strings attached. But it was hard because we didn't know when it was going to end, and those funds eventually did stop. If we implemented a guaranteed basic income program in Washington, House Bill 1045, with 2 years of consistent monthly stipends, I could go back to college, I could pay my bills every month, I would have dependable transportation with insurance, I could worry less about the increasing cost of food for my family and plan for my future. I want to represent those experiencing poverty and open a roller rink for people of all ages to go back in time and experience life without electric devices. I'm not asking for a free ride. I'm asking for the ability to live and pursue my dreams, everyone in Washington deserves to have resources to care for their loved ones and live well. Please pass House Bill 1045. Thank you for your time.
Thank you very much. Mr. Vice Chair.
Thank you, Chair. Next up, we have Jim Cooper and Amali Morningsong, and on deck we'll have Robin Von Davies and Umira Harris.
And do we have Council Member Cooper with us?
Thank you, Chair Sen and members of the committee. I'm Jim Cooper. I'm an Olympia City Council member, and I'm the president and CEO of United Ways of the Pacific Northwest, which is the trade association for United Way organizations across the region. I rise with both organizations supporting House Bill 1045. Thank you for proposing, hearing, and hopefully passing it out of your committee. We know from the Alice report that 1/3 of Washingtonians were struggling to get by every single month prior to COVID. And we all know that COVID only exacerbated the problems for those families, but they never recovered from the Great Recession. When we dig further into the data, we know that it could be upwards of half of our neighbors, half of our community struggling to get by. And I want to point out that the Alice report was created because the federal poverty measure is dead wrong. So it tells us the cost in every zip code in our state. A recent Alice report on children showed that 3/4 of children in the United States of America living with a single parent are in families that are struggling to get by every single day. It's very rare to have a federal pilot at scale to look at in hindsight when you write policy. And this is the opportunity for that, as has been mentioned, with the child tax credit and the stimulus payments nearly eliminating childhood poverty. Now, many people have spoke to the family and individual benefits, so I won't belabor that. But I want to step back a minute and say the single largest long-term savings for the state of Washington, its residents, and its businesses would be to implement a guaranteed income program swiftly and at scale. Now, we know that you're going to do it right and create the right way for the Evergreen State in this bill, and I greatly appreciate that and urge you to pass House Bill 1045 out of committee. Thank you.
Thank you, Council Member, for joining us with your two hats on. Appreciate it. Now I would like to welcome Amali.
Madam Chair, it looks like Amali and Robin are absent.
Okay, thank you. How about Amira?
Hello, good afternoon, Chair and members of the committee. My name is Amira Harris, and I am a private resident of District 28. I'm testifying today in strong support of House Bill 1045 to create a guaranteed basic income program in Washington. No matter our race, zip code, or how we make a living, most of us believe that everyone in Washington ought to be able to live a happy, healthy life. Families across Washington are unable to meet their basic needs. Though many of them work 2 or 3 jobs to try to stay afloat, greedy corporations keep driving up the cost of housing, medical care, clothing, and school supplies. Basic income isn't a radical idea. It was used for almost a decade in Seattle in the 70s, and today a pilot program is ongoing in Tacoma. In the last 2 years, the federal government has given most of us stimulus checks with no strings attached, a form of guaranteed basic income, lifting nearly 12 million people momentarily out of poverty in the process. This bill will not only impact me, but our communities at large too. There are far too many of our friends, our families, and our neighbors who are one missed or shorted paycheck away from eviction. I've had the very car that I use to shuttle my clients for work shut off by my finance company because it was either that or lose a roof over my head. The cost of care for our vulnerable children, elders, and people with disabilities are so high that people couldn't get a second or full-time job, even if their rent depended on it. While our tax dollars are spent on grants or tax breaks for new empty corporate buildings, our constituents are left feeling like they have to rob Peter to pay Paul and feed their children. As one of the leading states in progression for our people, we must do better. We must set a better example. Government decides how our economy is structured, not the invisible hand of the market. If we are to truly address the immediate needs of our communities, we must fund the things that actually ensure the financial well-being of Washington residents. A guaranteed basic income would do that. I urge you to pass House Bill 1045. Thank you for your time.
Thank you, Amira. Mr. Vice Chair.
Thank you, Madam Chair. If we could have Cherish Cron Miller and Puranjali De La Rocha.
And while we're waiting for them to come into the room or check to see them, I just want to thank our staff and our vice chair for this first experiment for this committee and how we are doing hybrid testimony. And as you can see, they're not really glitches. It's just we will have to see who might have signed in person but really remote, or who was with us at one point and then had to pop off to do something else. So thanks for everybody's patience. And again, thank you for the staff for working with us on this, and for Vice Chair Cortez. Great job. Do we have Sharish or Pantanjali?
Cherish Cronmiller.
Wonderful. Please proceed. Thank you.
Thank you. Madam Chair, committee members and staff, good afternoon. My name is Cherish Cronmiller. I'm the Executive Director of Olympic Community Action Programs, your community action agency for Jefferson and Clallam counties here on the majestic Olympic Peninsula. I'm here in support of House Bill 1045 to create a guaranteed basic income in Washington. OLYCAP currently has a pilot program for only 20 households, thanks to a generous anonymous donor that gave us $200,000 specifically for this initiative. These 20 households are getting $500 a month for 18 months, along with case management and support from OLYCAP, including optional learning sessions. With these 20 heads of household, they range in age from 21 to 65. They live all across the peninsula, some in very rural areas. 13 of them are employed, 3 are on disability, and the other 4 taking care of children full-time. Overall, this impacts 47 children in these 20 households. People have spent the money because we know what they're spending it on. We can track on their prepaid cards for after-school activities, kids' school clothes, food, car repairs, and gas for their fuel tank. These dollars have stayed local, and they focused on basic needs. Community action agencies stand ready to assist in the implementation of the guaranteed basic income. And bear in mind that basic income does not create dependence. Instead, it brings people potentially to a living wage. To answer the gentleman's earlier question about, the minimum wage versus adding this amount and reading criteria. First off, we never want to confuse minimum wage with a sustainable or living wage, right? We know that minimum wage is not adequate to actually sustain yourself and have rent and still money for food or fuel, things like that. So yeah, a person of one would roughly make about $31,740 on minimum wage at 15 some an hour, and then the minimum amount of 200% is a bit higher than that. I had pulled some of that up here. Now it depends on a number of programs if they look at gross or net earnings. Your gross earnings, being before some of those deductions are made, and then what else is accounted. As soon as you add a dependent to that, the federal poverty rate jumps to 36,000. So if somebody has a dependent, they're taking care of somebody else. Often our folks coming out of the prison system aren't getting full-time work, or because they have to check in with probation officers and this and that, their schedules are very hectic. So, so hopefully that answers that. I want to thank you for having remote testimony for those of us that live in rural areas and have a packed schedule. This is really meaningful. I'm happy to answer any questions, and any of those people that voted against this bill. Again, my name's Cherish Cronmiller. You're welcome to reach out to me. I'd love to talk to you about how our country has been trying to solve poverty since 1964.
Thank you, Cherish. Now, Patanjali.
Hello. Good afternoon, Chair Sen and members of the committee. Pialino Toka Patanjali de la Rocha, Ninihuala Ashkenazi Mishika Kalinga, Nachfaktia Nimikich Makli. My name is Patanjali de la Rocha. I'm Ashkenazi Mishika and Kalinga descendant from Mexico and the Philippines, and I live in King County, or unceded Duwamish and Coast Salish territories. It's good to be here with you today. Thank you for your time. I'm here today representing Hummingbird Indigenous Family Services. We launched in 2019 with the mission of healthy Indigenous babies being born into healthy Indigenous families, being supported by healthy Indigenous communities. Hummingbird is the first and only Indigenous agency in King, Pierce, and Snohomish counties to exclusively serve Indigenous babies and families from 0 to 3. As a program director at Hummingbird Indigenous Family Services, I spent the past year and a half deeply researching and community building to bring a guaranteed income to Indigenous pregnant people in King County. And based on my research and lived experience as a parent and person of Indigenous descent, I'm testifying today in strong support of HB 1045 to create a guaranteed basic income program in Washington state. As many have testified before me, we know that guaranteed income works. Despite the bootstraps narratives of handouts creating laziness, which rest on the flimsy logic that some people are more deserving than others of having their basic needs met, the research from over 100 guaranteed income pilots nationally shows that just the opposite is true, that people work more, are able to spend more time with their families, take care of their families, access education, contribute meaningfully to the economy, and have better health outcomes when they receive a guaranteed income. Poverty during pregnancy and early childhood is related to poor maternal and child health outcomes, delayed development in early childhood, increased rates of gender-based violence, and other health issues that disproportionately impact Black, Indigenous, and other communities of color across structural determinants of health. Despite making up less than 2% of the population in King County, Native Americans represent over half of people living at 200% of the poverty line. Everyone in Washington should be able to meet their basic needs and care for their loved ones. This is especially true for the original stewards of this land since time immemorial. This bill would not only support every Washingtonian in keeping a roof over their head, a stock pantry, and the ability to see a doctor when they're sick without worrying about the size of the bill, but it will also support the ongoing sustainability of pilot programs such as the GRIT program in Tacoma and as the Hummingbird Nest that support communities who are disproportionately impacted by legacies of structural inequity. Poverty is not an individual moral failing, it's a policy choice. I raise my hands to the Coast Salish people, the 29 federally recognized tribes in Washington state, and those yet to be recognized or who were lost to genocide. This bill is an important step for everyone in Washington and especially for Native and Indigenous families to help heal historical trauma and support healthy future generations. Thank you so much for your time.
Thank you so much. And Mr. Vice Chair, may we call the last testifier? One more testifier.
Could we have Jasmine Smith?
Hi, good afternoon, Chair Sen and members of the committee. My name is Jasmine Smith, and I am the political manager for the Washington Bus. I am testifying in strong support of HB 1045 to create the evergreen basic income because everyone deserves the basics, a roof over their head, a full fridge, and to see a doctor when they're sick. Specifically, young people across the state have seen a dramatic jump in how much it costs just to exist, and wages haven't kept pace with what we need. Everyone in Washington should have a happy, healthy life. And when it comes to solving the problem of poverty in our state, the answer is simple: to just give people cash. It's not a radical idea, and as you've been hearing, we've been using it already in multiple instances. It's no secret that our famously regressive tax code is one of the reasons that people experience poverty, and that those with the lowest incomes are the ones that are paying the highest percentage in taxes, while the wealthiest are allowed to pay the least. And GBI is an opportunity to bring balance to the tax code and right some wrongs. When we finally require the wealthiest to pay what they truly owe to our communities in taxes, then we can put cash back in the pockets of ordinary Washingtonians. So many of the young people, queer folks, disabled folks, communities of color, they're struggling to survive in a world that's just getting more and more impossible to keep up with. There's a joke that we're all passing the same $20 around, and it's true, but I don't want to live in a world where we have to rely on fundraiser websites to pay medical bills or rent out of the pockets of our neighbors and our friends that are struggling just as much as ourselves. With basic incomes, more people are able to afford housing and food, pay off their debts, and get full-time jobs, save for emergencies, and get the physical and mental health support that they need. Cash payments dramatically improve our lives and the lives of our neighbors and our communities, which is why I urge you to recommend passing HB 1045. Thank you.
Thank you so much. And again, I want to thank staff and the committee for the great work today. And for those who may be listening and did not get called up, you can submit written testimony, and we invite you and encourage you to do so. Thank you very much for the work for today. And with that, this committee is adjourned.